So I want to talk to you about what is called lately homeoprophylaxis. I want to talk to you and clarify certain issues concerning homeoprophylaxis. Right? I will tell you, there is a general idea of Arnica being used before an operation and after an operation. Many people, they say, I'm going to have a tooth extraction. Okay, take Arnica first, so you don't have much bleeding, and then take Arnica afterwards. This is entirely wrong. Why? Why? Because we use Arnica as a blood thinning of the blood. So if you have a clot of blood, Arnica dissolves this by thinning the blood. When you have a blow and there is extravasation of blood and there is blue, and the blood has created a clot, you give Arnica and like a miracle, this is dissolved. This is dissolved. Why? Because Arnica is acting like coumarin. You know coumarin? Coumarin is a blood anticoagulant. Like coumarin and like Marcumar. Yes. This is the homeopathic blood thing. That means Arnica is contraindicated before operation. Because once you have Arnica and you operate, you are going to have more blood. You see the craziness of some people. Not only that, but you may get, some people say, we had tried a research and we found out that Arnica helps. How they found Arnica helps is another story. You can make a research and prove whatever you like. The fact remains that when you have a heart attack, that means a clot, a blood clot, is closing an artery, then the first remedy you will give is Arnica. To do what? To act like as an anticoagulant and faster even than the anticoagulant. Do you understand some misunderstandings? Now, the Times of London wrote an article 3 months ago, and they say, homeopathy, voodoo medicine, why? He writes, the journalist, listen to this. Homeopaths claim that they can give a remedy as a prophylactic to the different epidemic diseases. How comes this? Of course, because some people, they have written books, articles, etc., saying we have the possibility to give a remedy as a prophylaxis. That means I give you a remedy, and if let us say an epidemic comes, like smallpox, you are protected. You believe you are protected. How is this? How? And when I ask, what is your reason for writing this and saying this? And the Times take this and write that you are voodoo medicine? What is your reason for believing that giving a remedy, let us say thuja or whatever, morbillinum, that it will protect you when the epidemic will come? He says, yes, but Hahnemann said that when there was an epidemic of scarlet fever during that time, 1799, yes, he gave belladonna as a prophylactic so the people would be protected from scarlet fever. See now the misunderstanding of what Hahnemann said and how this has been misinterpreted and presented as a possibility that we have for a prophylaxis. What happened with Hahnemann's idea? Hahnemann saw that a lot of people he was getting with scarlet fever, they needed belladonna. So he thought, why not giving belladonna to everybody so we may have less casualties? He thought he was doing a prophylaxis. What he was doing was giving a remedy in the beginning of the scarlet fever, so the scarlet fever will not develop fully. It was a curative action of belladonna during the epidemic. During the epidemic, the genius of the epidemic, that means the remedy that was mostly indicated in that epidemic, was belladonna. If you give belladonna, and you take belladonna, now the epidemic is raging, you give belladonna, you know the epidemic, you know that the remedy is very much indicated. Those people who would develop symptoms of belladonna, these only people will have a milder attack. That means the moment the symptoms come, the remedy comes and cures. It cures you from the beginning. This is totally different than saying that we give you a remedy, you are protected from smallpox, from chickenpox, from mumps, from whatever you like. All, we can protect everything by some people. This is not so. Why? I will explain to you immediately. You see, the action of a remedy is when only the symptoms are similar to the remedy. So you give the remedy, symptoms are similar, they are gone, cured. If the symptoms are not the same, and you give a remedy totally out, what you give is like giving a wrong medicine to a patient. What's going to happen? Nothing. Nothing. The patient comes back and says, I feel nothing. So this is the second possibility. You give first cure because it fits. Second possibility, you give no effect. How many patients will come back and will say, I didn't feel anything, okay? Because you have given the wrong medicine. Third possibility is that you give a remedy that was close to the case, and in such a case, you create a little bit of a disturbance. That means either the symptoms are going away for a while, or you have a proving, what call a proving of a remedy. But when we say a proving of a remedy, and we say to the people, come and have a proving, don't be afraid, what do we say? We say that this effect of the proving will go away within a month or two, finished. You have no problem in doing we accept from one side, therefore, that the action of a wrong remedy, you do a proving, is not your remedy. The action of the wrong remedy is only passing away if there is any effect at all. So, how can one maintain, claim that by giving you a remedy today, the next year when the epidemic will come, you will be protected? And I said to them, if you have said this to some people, and the epidemic comes and the child dies, where you are, what you are going to say? Oh, we are going to say that all vaccinations are not 100%. So our vaccination also is not 100%. You see how easy it is to get away from very logical arguments that can cause tremendous problems for the prestige of homeopathy. By having these crazy ideas circulating. I say, okay, you want to try to protect. Okay, wait until the epidemic is there, then find, after your 10 first cases, which are the remedies mostly running through the epidemic, and you find out, oh, this influenza is gelsemium. Okay, if you like, you can give during the epidemic, you can give the gelsemium, and if people develop symptoms of gelsemium, they will have very little effect because they will be taking the gelsemium. But you cannot say, I will give you today a gelsemium and the influenza will not catch you next year or next month or 3 months from now, or whenever the epidemic comes. But listen now, the Times, they wrote, listen to what these crazy people, voodoo people, are saying, that we have an alternative to vaccination. Now let us come to the idea of the vaccination as is practiced in the general medicine. What is the idea? The idea is we introduce the vaccine, whatever is the epidemic, and the organism is producing antibodies which then can fight the real epidemic when it comes. This is the idea. In my book, The Science of Homeopathy, not everybody knows the book, but it doesn't matter. You can read it. You can read it later on. There is a chapter on vaccination. And I have written this book in 1976. And still this idea is valid today. What I wrote during that time? I wrote that I made a full analysis who is going to be protected and how is going to be protected. I'll let you read it up, but I say only this, that if a person is really protected, that means the vaccination brought down his immune system, broke down the immune system and brought down his whole health, and therefore, after that, the specific epidemic cannot affect him. Why? Because now you have made him chronically ill. If you make a person chronically ill according to the teachings, he cannot anymore develop any infectious disease with high fever. There is no there is no power on the organism. What I want to, first of all, you to understand is that homeopathy has not that possibility to make you so sick with a remedy that you cannot get the disease. This is a mechanism, a simple mechanism. If you manage to bring down the organism, then he will be protected from acute diseases. But you have to bring him down, to break down his immune defenses. You have to do it in order to protect. Can with homeopathy claim to do this? Oh no. The only thing we can claim is during the epidemic to give a remedy. The other is total craziness, nonsense, etc. And should not be publicly claimed. Where are the double-blind tests to find out who was protected, who was not protected, etc.? And that makes me very angry. Why? Because it comes back to me. You see, because I'm dealing with the universities and the medical schools. I say, what are you saying there? My idea is that certain people are prone to have a big reaction with the conventional vaccination. And a lot of autistic children that we have today is the result of vaccinations. Therefore, my idea is before you vaccinate, find out whether that child complies with the parameters that should tell you don't vaccinate that child, because it's going to have a tremendous problem if you vaccinate. If we do research, we have the brains, etc., we have the means to do research, to find out which are these parameters that will not allow for a child to be vaccinated. Otherwise, we'll have a problem. The child will have a problem. Which are these children? And then let these children, because the after effects of vaccinations, if you weight them in the general population, let us say you vaccinated the whole 6 billion people living today. You manage to bring down their health. What are you going to do? You are going to do a kind of creating a race which is going to be forever chronically ill, more and more and more and more. And no healthy people will ever be left in this planet. And but they live longer now. Yes, they live longer, but what is the quality of life which we live longer? Is this quality of life? Is this quality of life that we live longer, in which we bring us all these wars? Huh? Crazy minds? So unless, now why do I say that? Because some of you are going to say, now, hell, wait a moment. What are we doing? We don't want to vaccinate until we find out if my child can be vaccinated. Because if my child is going to be vaccinated and become autistic, I don't want it. If the epidemic comes, and if it is his karma, let him have, and then treat the child. Once the child is sick, you treat the child. The argument is, but the poliomyelitis was killing a lot of people and paralyzed, etc., etc. Yes, but they did not have homeopathy. They did not have any means to fight. But this is not homeoprophylaxis, it's homeocuring, not homeoprophylaxis. It's curing with homeopathy. This is what I say, we have to find out whether a child could be vaccinated and not have a dramatic effect on his health. There are certain signs that we can observe in a child in which we'll say if the child has these signs, should be excluded. There are some signs that we can be finding out if we really do research on this and find out which are the children. For instance, take all the autistic children which came after vaccination and take a very detailed report from the mother how was behaving the child before. This is one research. And you may find out that all these children that had a common factor.
Okay.
So you say, well, let's see if this is responsible, etc. But today genetics have progressed quite a lot. So if in the genes, in the DNAs, you find a predisposition for a neuromuscular disorder like etc., etc., you must say this child should not take polio vaccination. You know, these kind of things. There are a lot of measures that can be taken.
So what are the roles of our remedy that we say after effects of vaccination and silica and thuja?
Yes.
And so
To bring back the balance, that means the person whom you treated, he can again be infected by the disease from which was supposed to be protected. If you really can cure him, then you make him again sensitive to the original
condition.
Disease, epidemic disease, from which was supposed to be protected. These are facts. Whether we like it or not, it's another story. These are the facts. You will say, okay, you imagine a world with healthy people. And some of them, they have to die because of some weaknesses, deficiencies on their immune system. Some of them, they have to die perhaps early. And all the others, they live in a healthy state. Do you know, I mean, if you analyze why this has happened, why this phenomenon has happened, where we, save me, save my life, whatever, give me an injection. Now is coming the bird flu, eh? They sold out all the all the vaccinations. Give me a vaccination to save my life from bird flu. Nobody was actually falling down sick because we cannot be infected, actually. Say, this, behind all this is the fear of death. Behind all this is our fear of dying. Why? Because we have not been educated at all what is the meaning of life and what is the meaning of death. We don't. We know the unknown. Wow, I'm going to die, I'm going to go, where I go, blah, 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 and all these kind of things. And then you rush to save your life, and during this rush, on the rush, you kill yourself. You know how many people, sometimes the patients, sometimes the patients, they rush to save their lives. I just had I may read it to you. A person dying in Sweden. He's dying. And they wanted me to treat, and I said, come here, but he's in the last days, he cannot travel because cancer is exploded all over, he's finished. Now, this person tried to save his life. He took cytostatic drugs, chemotherapy. Within a month, he was finished. He would be able to come here if he had not taken cytostatic. He would be able to come here. Maybe homeopathy could have saved. They want me to save his life till 19th of June because he wants to marry a woman with whom he was in love, madly in love. And they have said 19th of June we'll marry. So the wife says, please keep him alive until 19th of June. That means 3-4 more days. He is lying in bed, exhausted and all that. And my email was out of order for 2 days, 3 days, was out of order. Especially for him, I could not answer because I only had his email. But anyhow, the rushing of taking the chemotherapy many times has exactly the opposite effect. Does not save you. It just speeds up your end.
It's back to Arnica, question about Arnica.
Yes.
Arnica is routinely given to women in childbirth, before childbirth.
Before childbirth.
Can you say if that is also
Before
wrong?
childbirth, it may have a meaning in reducing the rigidity of the os uterus. Or I would have suggested something else, of course, which is according to each organism, the remedy that it needs.
Back to vaccination, and
Yes.
allopathic doctors and medical students have to be vaccinated. It's
Yes.
compulsory
Yes.
to hepatitis B.
To hepatitis.
And university students have to have
Yes.
meningitis, otherwise you cannot go.
Yes.
So there isn't an alternative.
There is no alternative, no.
Yeah.
No, unless we all agree to bluff. To bluff and say, we have the alternative, and you give sugar, nothing will happen. If you give sugar, they will not be affected. They will not be, because there is no epidemic. Why? Because we are very sick to have an epidemic. Very few people are really healthy to get the epidemic. And once I am the one who is healthy, but all the other cannot get it, okay. If I get it, I cannot give it out to anybody. You see, because most of the population is unhealthy and cannot spread. So the epidemic will be of a limited number. But watch out, because if we continue in this way, giving continuously a lot of vaccinations and changing the immune system, there is going to be a time when there will appear some microbes, bacteria, viruses, which will be so virulent that they will take the life of millions suddenly. Because AIDS is one of them. AIDS is one of them. The interesting thing is, they say, broken down immune system. The AIDS means an immune system that has been broken down. By what? By antibiotics, by vaccinations, by whatever. And then AIDS comes. I need my glasses. Okay. Now, I want to read you something that is very short from the British Medical Journal. This is British Medical Journal, 14 of June, 2007, concerning the vaccine Gardasil, which is given to young girls to protect them, supposed to protect them from having cancer. Gardasil, the vaccine which is given to the young girls, and this is a summary from a report in the British Medical Journal, and I would like to read it to you very fast. The HPV vaccine, which has been given to girls aged 11 to 12 to prevent cervical cancer in later life, may be a killer. So far, 3 young girls have died after being vaccinated. And there have been 1,637 adverse reactions reported in less than a year. 1,630 reported. Never mind the unreported. And continues, in Australia, 25 girls at the same school who had been given their first HPV vaccine last month experienced headache and nausea, and 4 of them ended in the hospital. Otherwise, there are no side effects. The vaccine, the British Medical Journal is a report. I'm not telling it myself. The vaccine Gardasil has courted controversy since it was approved for use last year. Some states in the USA have decided to make the vaccine compulsory, which has caused an outcry among parents who see the vaccine as a license for sexual relationships outside of marriage. The theme I was talking yesterday, sexual liberation, and I will add a few things now. Gardasil is supposed to protect against human papillomavirus type 6, 11, 16, and 18, which cause most cervical cancers and genital warts. A public interest group, Judicial Watch is called the group, discovered the extent of the adverse reactions only when they made a request to the Food and Drug Administration under the Freedom of Information Act. Presumably, the FDA would have preferred to have stayed silent rather than alert the public about a vaccine that may need more safety trials. I will give you a copy. In each one of you, you will get a copy to have it and give it to your patients when they ask you about this. Is the British Medical Journal, they say so. We don't know. We don't know anything.